Okay, so it is right at 10:01, so we will get started. Good morning, everyone, and welcome to our first open research office for 2026. My name is Marshall Brooks. I'm one of the clinical research facilitators here in the CTSI, along with my coworker Alexis O'Brien, who's also on this meeting. Today, if you have any questions during the presentation, we're going to ask that you either put it in the chat or you can use your raise your hand function during the presentation, and Karen will get to your question. Today, our presentation is on turning clinical data into community insight, a population health dashboard for Western New York. And Karen, you can start whenever you're ready.
Okay, wonderful. Thank you. And glad to be kicking off. Okay, so I believe, can you see?
Yep.
Okay, fantastic. I just want to move this over and all right. There we go. Okay, so good morning, everyone. As Marshall said, I'm Karen Craig, and I'm actually kind of filling a dual purpose this morning. So I am a clinical assistant professor in the School of Public Health in the HSA concentration, and I also advise with HEALTHeLINK. So my work at HEALTHeLINK is a senior advisor for regional health improvement. So I'm kind of feel like I'm doing a dual role this morning. In the past, before I became a professor at UB, I was part of the clinical CTSI. So it's just kind of interesting how everything just kind of comes full circle, and I'm really happy to be here today. So today we're going to be talking about clinical data and community insight, population health dashboard for Western New York. So what we're going to be covering today, and I know I only have an hour and I have a tendency to talk long, so I will try to keep myself in check. But I think it's really important to give a historical context of how we got to this place and how we got to this population health dashboard, community health dashboard. So I'm going to talk a little bit about HEALTHeLINK itself and the history of how we got here. And so we're going to talk also a little bit about how we're using clinical and claims data and using that for population health and community health purposes, and then how the timely granular data can really help with population improvement efforts and improve those outcomes. All right, so first, if you are not familiar with HEALTHeLINK, it's a regional health information exchange, and HEALTHeLINK collaborates with hospitals, physicians, health plans, other healthcare providers throughout the 8 counties in Western New York. Now, we are one of multiple HIEs across the state, but again, HEALTHeLINK covers all 8 counties of Western New York. So it was originally created to improve the quality and delivery of care through secure electronic exchange of clinical information. So from provider to provider, right? That's how they were originally designed. The third bullet point, most important, patient consent. With patient consent, and probably a lot of you on this call have consented to having your data, health data, shared with HEALTHeLINK. So with that consent, providers can access a patient's clinical data electronically, allowing data to follow wherever the patient goes, whatever healthcare setting they are at. If you find yourself in the emergency room and you have consented to HEALTHeLINK, and that physician is a provider that is within the HEALTHeLINK system, they can see all of your information. HEALTHeLINK is part of a statewide network called the SHINY, which is the State Health Information Network for New York, and we're certified by the New York State Department of Health as a qualified entity. So the last bullet point really talks about the history too. There's a recent merger. I'll talk about that in a little bit with PHC, that stands for Population Health Collaborative, and that added the regional health improvement to its mission. So this is a timeline of HEALTHeLINK. So originally HEALTHeLINK started back in 2001, many years ago, as HealthyNet. And you can see throughout the timeline, throughout 2006, where HEALTHeLINK became established with funding from the key stakeholders. And then we've moved on in 2008 that we had secure and efficient sharing of clinical data with, if you're familiar with HL7 and transcribed reports. 2013, 2014. By 2014, all Western New York hospitals were participating. Patient record lookups exceeded 1 million, and CCDs, continuity of care documents from provider organizations, began to flow. And then really I want to fast forward to 2022, where again, the merger of Population Health Collaborative and the HEALTHeLINK came to be. And that's really how, this dashboard came to be. So the data, what do we have? What does HEALTHeLINK have? So in a nutshell, we have a lot of data. So we have 100% of Western New York hospitals participating in HEALTHeLINK and sending data. Admission, discharge, transfers, lab reports, radiology reports, transcribed reports, CCDs, again, continuity of care documents. 70% of Western New York physicians and practices are sending their data. That might actually be a little bit higher right now. Nearly 100% of laboratory results are available, more than 90% of radiology reports, images from more than 20 radiology facilities, claims data through all lines of business, from 4 health plans with more on the way. And then 90% of Western New York practices are participating. So we have a lot of entities participating with HEALTHeLINK, which means we have a lot of data in our warehouse. So this is just a slide to show you some of the current data sources that we have. Really what I wanted to point out here is the claims data. Not only do we have clinical data from EHRs, but we also get some claims data. So Highmark, Independent Health, Univera, Molina, which is Medicaid, Amerigroup, Fidelis, Medicaid, Medicare fee-for-service. And we are currently working on a project with New York State Department of Health for their Medicaid claims feed. So again, I can't emphasize enough that there's a lot of data flowing through HEALTHeLINK. We do have some state and national connections as well. So we have a statewide patient record lookup. What this allows us to do here is it's a New York state-run service that providers search for and retrieve patient records across other New York state qualified entities. There's an eHealth exchange, which is a national network that connects federal agencies like the VA. Civitas Networks for Health, so it's formerly Chic, but Civitas Networks is not necessarily how we flow data, but that is part of a national network. So nationally, all HIEs, are part of this network. So it's just a great connection between other HIEs throughout the United States. And then patient-centered data homes. So here it's a national interoperability model that's built by HIEs. So it routes patient data to the HIEs closest to where the patient lives. So right now, you look outside and there's a lot of snow, and maybe, somebody who kind of travels to Florida, right, for the winter. So this would give us the opportunity to look up patients' data, for somebody who lives here for a few months and then goes to Florida for a few months as well. So by the numbers, again, this is just another, approximately 6,000 participating providers, 90% of the population has consented. Really important for that. Again, you might have signed a document that allows your health data to be shared through HEALTHeLINK. More than 90% have consented to have their data shared. So that means we have a large majority of patient health data flowing through the HEALTHeLINK system. And a query of HEALTHeLINK occurs every 4 seconds. So just in the time I talked, it's actively being used all the time. So a quick little slide to just kind of show how this all works. So we take your lab results, radiology, EMR records, medication, ADTs, transcribed reports, and information from the Shiny, and it all funnels down into one record, your record, one individualized record. Okay. So there it is. Okay. So now moving on to the merger between HEALTHeLINK and Population Health Collaborative. So this went down in about 2022. And so the next slide kind of talks a little bit about the pre-merger, the merger, and post-merger. So Population Health Collaborative, maybe some of you have heard of it, called P2 Collaborative. before this merger happened, we identified the need for a regional community health dashboard. So in my 25 plus years of experience in working in community health and public health and population health improvement, I've sat at many, many tables where we discussed the fact that it would be great if we had zip code level data. It would be great if we had data that wasn't at best 5 years old. So we knew that there was a need for this. And so the early planning and concept development began to create a community health dashboard. Now, HEALTHeLINK was a very active, engaged partner with this pre-merger. We were planning on working with HEALTHeLINK all along to help build this dashboard. And HEALTHeLINK was a longtime partner of Population Health Collaborative for many, many years. We shared a physician advisory council. Many of the board members that were part of Population Health Collaborative were also part of the board with HEALTHeLINK. So we had initial discussions and focused on data sources, governments, and use cases, etc. Then the merger happened, come 2021-ish. So we merged. And so with that, the Regional Health Improvement Department, for lack of a better term, was established, where we were doing regional health improvement efforts. Now, to define regional health improvement, it's what I term as population health improvement. We call it regional health improvement because we're looking at the 8 counties of Western New York. And Population Health Collaborative really focused on population health improvement. So we took what we did at Population Health Collaborative, kind of plunked that into HEALTHeLINK. Stronger than before because now we had the data to use. So the community health dashboard during the merger kind of elevated as a strategic priority. So we were able to kind of fast track this dashboard because of this merger. So we had a shared infrastructure, the leadership was aligned, and we had really good momentum to build this dashboard. So post-merger, the dashboard development was in fast track mode. We built the dashboard leveraging our clinical and claims data that was already housed in the HEALTHeLINK warehouse. And then we came up with a fun name. We call it HEALTHeWNY. HEALTHeLINK likes to tag everything with health E whatever. HEALTHeLINK, HealthyNet, Healthy Outcomes. There's a new thing out now called Healthy Intelligence. So we stuck with HEALTHeWNY. Okay, so now we're on to the dashboard. So when creating this dashboard, we had a lot of input from our community partners. And we asked many, many times, what do we want this community dashboard to be and who do we want it to be for? So this is a data visualization tool that provides a comprehensive overview of the health status and trends within Western New York. So it includes key health indicators such as rates of chronic disease and health behaviors, and there will be more to come. It's not a one and done. We continuously add metrics as the years go on. So this can be used by and designed for public health officials, policymakers, healthcare providers, community leaders, so they can monitor health outcomes, identify health disparities, and inform health promotion strategies. Again, going back to the who do we want this for? We really had those community partners in mind who never really had access to granular, timely data. For years and years and years, we were working with data, like I said, at best 5 years old, county level maybe. So we really wanted to create something that would inform the non-clinical partners and the grassroots community folks so they could get their hands on some good solid data.
Karen, we have a question.
Sure, go ahead.
It says, does HEALTHeLINK include retrospective data on patient records that precede the establishment of data sharing agreements, patient consent for data sharing, or provider partnership agreement dates? This would be needed for looking at slow-moving individual or health population issues.
Well, it just so happens that my good friend Steve Gates is on this call, so I'm going to turn it over to you, Steve, to answer that. Thank you.
Sorry, Marshall, could you repeat that?
Sure. It says, does HEALTHeLINK include retrospective data on patient records that precede the establishment of data sharing agreements, patient consent for data sharing, or provider partnership agreement dates? This would be needed for looking at slow-moving individual or population health issues.
So I think I can answer the question by saying this. The data comes to HEALTHeLINK at the establishment of the participant partnership. That data that comes to HEALTHeLINK does not require patient consent by state policy. Okay. The sharing of that patient's data or that using of the data for treatment or other purposes does require patient consent on an individual basis. If we're using the data on a aggregate basis for the purposes of population health, again, consent kind of takes a backseat because we're not releasing any PHI. Did that answer the question?
So this is Kelly Baker. I'm the one that asked the question. Sort of. What I'm looking at is, these agreements were relatively recent, like in the last 2 decades. But if you wanted to look at population health information going back to 1990 or 1980, do the agreements kind of grandfather in a lot of that older data that might be in the system somewhere?
It does not. We've been collecting data, and the data that is presented is from 2007 and forward. We don't have availability to the data beyond previous to that.
Thank you.
Thank you, Steve. Glad you're here. Okay, and thank you for your question, Kelly. Okay, so HEALTHeWNY, built on partnership. Nothing about the dashboard is done in a vacuum, okay? So I have absolutely no business deciding what goes on that dashboard without input from our community partners, because it is designed for our community partners. It's designed to support community-based organizations and health departments who are lacking zip code level data access. And again, the timely data, timely local data for community decision making. So for example, the Witness Project from Roswell, they have mammography bus, among other organizations that have mammo buses. Where do I need to park the bus? Where are people lacking in breast cancer screening? So they can use this dashboard to, park their mammo bus by zip code. So the metrics and consent are all community driven. Whatever metrics that we post is what the community partners tell us they need. We have a regional health improvement committee that helps us decide what metrics go on the dashboard every year. We also get input from all of the local health departments. We meet with them regularly. We send out surveys. What would you like to see? HEALTHeLINK figures out what's feasible, what's not feasible. So none of this is done without community partner input. And like I said, it's designed and co-created through regional collaboration. We've gone through a number of iterations of the dashboard, and people are telling us how they want to see it. And knowing the audience that we have in mind who are using this, it's keep it as simple as possible. Give us one number and make it easy to use. Give us the percentage. Please don't make me go through all of these different graphs and charts and all this complicated stuff. We were told from the very, very beginning, please keep it simple. So we've tried to adhere to that. And actually, I think we have. So why is this important, and why do people love it, and why do people use it? Data-driven decision making. So this provides accurate, up-to-date data, enabling partners to make informed decisions about health interventions and policies down to a zip code level. This will help us to identify some health disparities. There is a page on the HEALTHeWNY dashboard that will allow you to compare zip code against county or within zip codes if you want to compare certain races, county against region. There's all sorts of ways that you can identify disparities. There's also a really wonderful geomap where you can kind of move your mouse around on Erie County, let's say, and you can at a glance see the certain percentages of whatever metric you're looking at and pick the highest or the lowest depending on the metric that you're looking at. This allows us to track health outcomes over time We're building trending pages as the years go along, so you can see how those trends go up or down. And then where do we allocate our resources? Community-based organizations are famous for, being bombarded with so much work, but not having a lot of funds, staff, resources, etc. So where do they need to really hone those resources in? And by using the dashboard, they can pinpoint certain areas across the region where they need to, where there's the greatest need. And community engagement. You can actually pull data from the zip code for folks who go in and do any kind of community engagement work. They're holding community conversations, focus groups. You can collect some health data specifically from that zip code wherever you're hosting your community conversation, and you can show the data to your group of folks and then base questions on that, ask for their reactions to that, etc. And then a lot of people use this as an advocacy tool. Working with local policymakers, even statewide policymakers, they use the data that they collect from this dashboard for a tool to help with advocacy. So now in the very beginning, we had to start somewhere. And hold on, I'm just clicking. Okay. So we had to start somewhere. And back at Population Health Collaborative, we had this initiative called 3450. And 3450 is a framework that is used that describes 3 lifestyle factors that lead to 4 chronic conditions that lead to 50% of premature mortality. And it's right up there on the slide. So we had this initiative called Live Well Western New York for many, many years. And it was surrounded by by the 3450 framework. And a lot of our community partners already knew this framework. They bought into the framework, and we did a lot of work surrounding the 3450. So with input from our community partners and local health departments, we thought that it was a good idea to just start with the metrics that had to do with 3450. So on the slide right now, you're seeing the initial metrics that we started with. We've added since then, but we started with diabetes poor control, hypertension poor control, colorectal breast cervical cancer screening, tobacco, and obesity. And along with that, we wanted people to be able to filter however they saw fit. So there's a filter piece on the dashboard. You can filter by county. You can filter by zip code. There's a sliding age range there that you can look at, 40 to 50, etc. You can factor by ethnicity, race, sex, and then year. As the years go on, you'll be able to filter out more and more years, and you'll be able to look at that trending. So it's really interesting that you can get even more granular. The other thing that our community partners wanted to do, and we thought it was a fantastic idea, is to add other data sets to give a more complete picture. So we decided to go with the Area Deprivation Index, and this is from the University of Wisconsin, and it's based on census data. So it uses census data to rank neighborhoods by socioeconomic disadvantage. And what we show here is a median ADI of zip codes. So on that right-hand side where you're seeing Western New York, 10 being the least disadvantaged, to 100 being the most disadvantaged. So where you're looking at like the dark reds, the reds and the dark reds there, that's the most disadvantaged. And then you can pull that up and you can see what zip code that is. Maybe there's a 95 ADI, and then you can go back to the health metrics page on the dashboard and look at the health outcomes that are associated with that most disadvantaged zip code. So it just gives a greater picture. And this comes in really handy when people are writing grants. They're painting the picture of a disadvantaged neighborhood, a disadvantaged zip code, a disadvantaged cluster of zip codes. And guess what? There's poor health outcomes to match that. So it makes a grant application pretty strong. So where to find HEALTHeWNY? And if there's time at the end, I can go into a live demo, but I wanted to just show some slides up here at first. So when you go on to the HEALTHeLINK website, it's right up there at the top. You just click on HEALTHeWNY, and then You will have to scroll down a little bit, and then here you go. So this is where you enter the dashboard. So right over there on the right-hand side, that's a button that you click on enter the dashboard, and the first thing that you are going to see is this page. And I like to call this at a glance page. And there's a couple of things that I'd like to point out with this. So the first thing is the HEALTHeLINK records. So 1.5 plus million records that we have. And that is what we base, that's our denominator there. That's our starting point. But depending on, if you filter out, if you were to filter anything over in the, different county, different zip code, it will, automatically update that denominator for you. So these are the health conditions, health behaviors that we currently have. So in addition to what I showed you before, we've added on asthma, low birth weight, preterm, and pre-diabetes. Now, when it came to hypertension and diabetes, and I did talk about poor control, this details tab right down over in here will show you the poor control rate of diabetes and hypertension. But this is the at a glance. If you want to take a look at Erie County at a glance, you just filter out by county. I'm trying to think if there's anything else that I wanted to show you on this page. So up here is our disclaimer. So data is derived from adult electronic health records through Western New York's regional health through HEALTHeLINK. So this right now we're showing from 1/1/2024 to 12/31/24. That's what this page is showing. Come end of March, maybe the mid-March to April-ish, that's when we will update for 2025. So by mid-April, we will have data to the end of 2025. Now, in my years and years and years and years of working in this space, never have I ever worked with a dashboard that gave me this up-to-date data. Okay, so here we are by March, end of March 2026, I'm getting data that from 2025. 25 plus years, I've never been able to see that. I've never been able to see that at a zip code level. So I'm incredibly proud that we're able to give this to our community partners. And this is something that I have not seen any other HIE do that is public facing. This is something that HEALTHeLINK has taken on as a priority to provide a service to its partners. This is, in my opinion, I believe that this is unprecedented. I've been to national conferences and nobody has this yet. So,
Sharon, two questions.
Sure.
So one, while the dashboard is helpful for a high-level overview, I need access to the raw data set to perform statistical analyses and develop predictive models for disease and health disparities. Could you please advise on the process for requesting raw data access for research purposes?
I could give you the very brief version, but I'm going to let Mr. Steve Gates again give the full-blown version.
Yeah, HEALTHeLINK is currently supporting a number of research projects and protocols at the university. Best way is to contact us directly. We'll have you complete. We'll get a brief overview of your study and how we might support it. We may look to be written into a grant to help offset the cost of providing the data. And we do have a research process that includes the completion of a data use request application, a review of the request by a HEALTHeLINK research committee, and ultimately, once the research protocol or the research study is approved, we would work with you to provide the data that needs to be provided. So it's kind of an extended process, but starts with reaching out to HEALTHeLINK. Again, we've supported. I think we're up to 20 different studies from different researchers at UB.
Okay, so that was question one. Question two, just to clarify, the dashboard does not have any pediatrics data.
I'm very glad that you asked that question. We do. If you see the purple tabs, then that shows pediatric data. And actually, I have a slide that shows what that looks like when you click into pediatric. So just give me a second with that, and we'll show the slide with that one. But with the first question, I'm really glad that you asked that question. I get asked that question all the time. Somebody looking for a deeper dive into data. And again, you're right. This is the at a glance, and anybody can use this dashboard. But if this dashboard doesn't provide you exactly what you're looking for, if you're looking for raw data, for example, we're not going to show this the raw data because it's public facing. And also on that note, if anything is less than 100, we don't show it to protect patient anonymity there. So I know that a lot of folks on this call are going to want some raw data to do their analytics. And this dashboard doesn't necessarily do that. But if you work within the community, this dashboard could be for you. If you're looking to just grab some numbers about certain zip codes with the metrics that we're showing, this dashboard could be for you. I never expected that this dashboard be the end all be all, like the answer to all your data prayers, but this is one that you can use in addition to other dashboards that you already use. So I appreciate that question, and thank you, Steve, for being here to answer.
There's one more.
Okay.
If we are conducting studies that are across the state of New York or other states, can we obtain the same information outside of Western New York?
I'll take this one for you, Karen. Right now, you would likely have to go to these all six or the qualified entities that are servicing the areas that your studies include. As time moves forward, there is a move to bring the data together on a statewide basis. So there will be statewide services that will be developed to support research on that level. So yes, we're working towards that. We're not quite there, but each of the QEs has their own processes right now for provision of data for supported research. And just, there are 6 QEs, one HEALTHeLINK here in Western New York, the Rochester Rio, one in Syracuse, which covers the central New York, a lot of the southern tier, and the Hudson Valley. There's a capital region, and then there's 2 down in New York City.
Okay. Thank you, Steve. All right. Okay, so this page shows you that we can show you Erie County. So with this one, I looked into the obesity details page, and you can see up at the top and the filters, you're looking just at Erie County, but I didn't filter out by anything else. And then in the middle box here, we want to show you, what you're looking at. So it gives you your current selected population. That is the non-filtered population of Erie County. And then we like to give you a comparison. So the New York State obesity rate, and then if you click on that state, it's going to take you directly to the New York State Department of Health, where we took that from. They do not use clinical and claims data to calculate, but we were told by our partners that it's good to have something to compare it to. So our selected population of obesity rate in Erie County is 34.2%. And then we factor it out by race. Now over here, and this is a screenshot so you can't see it, where, the zip code, you can scroll around on the highlighted area and it will pop up by zip code and what percentage of obesity that is going to be. And I actually do have a slide that shows you that. And here we are. So this was found by scrolling around on Erie County, and 14150, obesity rate 39.6. And it gives you the population of that specific zip code. And again, everything is what we have in the HEALTHeLINK records. Okay. So just another example.
There's another question.
Sure.
It says, you mentioned 70% of providers in Western New York participate. Do you have information about spatial coverage for providers? For example, is that 30% of non-participating providers in rural Western New York?
Steve.
I'll help you out again, Karen. Yes. The stat is 70% of provider offices participate. The actual number of providers that send data to HEALTHeLINK is closer to 85% just because of the distribution of providers amongst those provider offices. The smaller offices that do not send data are those that still might not have an electronic medical record. And you're right, in some instances, those are the rural providers who are close to retirement, or have very unsophisticated EMRs that aren't able to connect. So yeah, I hope that answers the question, Kelly.
Yes, thank you.
All right. And so somebody asked about pediatric measures. And yes, this is an example of what a pediatric page looks like. You know you're on a pediatric page because there's cute little baby faces up at the top, and we put some purple in there. So you'll see the age only goes up to 17, and you can filter out that age as well. If you're looking from 5 to 10, you can change that age. And again, you can filter however you need to filter. So here we're looking at Niagara County. We're looking at the asthma percentage. And it tells you what you're looking at, which is really nice. County Niagara, age range 0 to 17, factored out by race. And again, you can use the geomap on the right-hand side there to just kind of filter through and take a quick glance at the different zip codes within Niagara County to look at the pediatric asthma rates. So this is one of my favorite pages where we can do comparisons. So in this example, all I showed you here was Erie County for population 1 compared to all of Western New York. But what you can do is you can compare Erie County and Erie County if you want to compare race. You can compare a zip code to Erie County, zip code within zip code. However you want to filter and compare, you can do that on this page. And the numbers will just automatically calculate and pop up for you. However, for whatever metric you're looking at, it will give you the denominator. And then up at the top, you see pediatric comparison. If you click on that, that gives you a link to the pediatric comparison page that looks very similar to this. There's just purple on there. So this is a great, again, at a glance to find those disparities, to find how one zip code compares to the rest of the county or the region or, however you see fit. So it's one of my favorite pages to use. And I think others really enjoy this as well. Okay. We were also asked to create a comorbidities page. So, okay, sure. So we did that. We're looking at diabetes, obesity, hypertension, tobacco use, and asthma. So what I'm showing here was when the boxes highlight in black, you'll see obesity. So that 100% shows out of all the individuals living with obesity, and then it goes from there. The rate of diabetes is 24, rate of hypertension is 47.89, et cetera, et cetera. And again, as always, you can filter however you see fit. This was a big ask from all of the health departments. They were very interested in comorbidities. So we created that for them. So it's a great page. Okay, so as I said before, I never expected this dashboard to be the end all be all, the answer to all of your prayers. So there are limitations to this dashboard. So we are dependent on the completeness of EHRs. It's only as good as what's in an individual's EHR. And that's how we create our warehouse. So individuals who are not engaged in the healthcare system, and this really holds it in the more rural areas, are not captured. If somebody doesn't just go to a provider, a doctor of any kind, then they're not going to be in our system because that's how we get their EHR record. So there are limitations. And we're always, always, always trying to improve the dashboard because the dashboard is only as good as it's being used. So I am always open to feedback, suggestions, ideas for metrics. We're about to go into our the next iteration of this year and what do we want to put on this year. So we will again be working with our Regional Health Improvement Committee that's comprised of some folks throughout the region. We will be working with our local health departments again to, what do we want to see on the dashboard now? What we're hearing, just the rumors, some mental health information, and some utilization metrics. What are, emergency room numbers? How many people have a primary care physician? Things like that. So that's what we're going to take a look at, and we'll see what we can deliver to our partners.
Karen, this may have been referring to the last slide, but it was asked, does this reflect zip code of the provider or the patient?
Let me see if I can figure out how to go back. If you're referring to the comorbidities, I'm sorry, zip code. Oh, zip code of the patient. It's where, I think this is what you're asking, where the patient lives. Is that the question that was being asked?
I believe so. William, if you want to unmute yourself, you were the one that asked the question.
Yes, I was just asking if it was the provider's zip code or the patient's zip code.
Patient zip code.
Thank you.
Mm-hmm.
And then we have one more that says, do you have data? And we have two more. Do you have data on the % of pediatric patients who are enrolled in HEALTHeLINK?
Yep. I can take this, Karen.
Yeah, sure, go ahead.
Okay. So remember, for the dashboard, we're using aggregate data, and consent doesn't apply. So it would include all pediatric data that we receive. Again, consent is not required to upload data. So it is a very high percentage of the pediatric patients whose data would be included in this. For use of the individual PHI on pediatric patients, currently about 65% of pediatric patients have a consent form in place. So I hope that answers both questions there.
And then the last one was, do you have a data dictionary to know which variables are available?
Thank you for that question. So up here, glossary and resources, this gives you all of the definitions of what we, how we define our metrics. Also, let me see if I can go back to the original. So when you click into any of these detail pages, it will give you the definition as well. There'll be a little information bubble up at the top that, just as a reminder of how we're defining asthma, but the glossary and resources page gives you the definitions of all of those. So I believe that, well, we've been taking questions all along, but I'm happy to take more. And we still have 15 minutes left, and I don't know if folks are interested in a live demo. I'm happy to do that. But I also just wanted to give both of my email addresses, so my Buffalo one and my HEALTHeLINK address. And I'm thinking that if you have questions, I'll probably just send you off to Steve. So I think Steve should just put his email address into the chat box, so you could just skip the middleman and go right to Steve if you have some deep research questions about larger data sets. But happy to take more questions, comments. This is an hour, correct?
Yes.
And if I still have a captive audience, I'm happy to show a live demo if folks are interested in that. I can stop sharing real quick.
It looks like only a few have logged off, so if you would like to do the live demo, I just want to let everyone know I have posted 2 sets of QR codes in the chat. The most recent one is for our post-session survey, so if everyone could scan that and take it before I lose some of the audience, that would be very helpful. And then if you scroll up in the chat, I've attached a PowerPoint slide for people that need different resources throughout UB from all of our different CTSI cores. So there's bioinformatics, team science, community engagement, here with us in clinical research facilitation. So there are QR codes there as well. And then Karen, it looks like we still have about 32 people on, so you can do the live action if you feel fit.
Hopefully people are seeing the HEALTHeLINK website. Okay. Yep. So as I said, right up here. So we click into HEALTHeWNY, and you do have to scroll down a little bit, and there's the dashboard. Now, doing a live demo, sometimes things just take a couple seconds to update. But let's take a look at, I want to show you an example of what happens when we get less than 100. So I'm putting 14222 in, that's where I live. And let's take a look at this. So as you can see, everything is going to show up either as 0 or it's not going to exist because the population is low. It's less than 100, and we're not going to show that to folks. So you can clear filters here. Somebody asked about glossary and resources page. So there's that. Here's all the definitions that we use for the metrics that are being covered. So if we want to look into some pediatrics, let's take a look at pediatric obesity. So right now we're looking at all Western New York, and you can tell that over here because it says all. So let's go into Erie County. I'm happy to look at, if anybody has anything that you want to look at in particular, you can shout it out at me by race, sex, age, break down the age group a little. Any thoughts? Anything?
Kelly asked if we could show how to create an account.
Oh, you do not need to. You don't need to create an account. So you just go on to the HEALTHeLINK website, click on HEALTHeWNY, and all this wonderful stuff is at your fingertips. It's kind of fun to play around with the comparisons. So let's go ahead, and you kind of can get into just some fun stuff here, playing around with what does this zip code look like, or this, if you're looking for racial disparities, perhaps. So it just takes a moment. So here are the denominators we're looking at, and we're looking at Erie County, and here are the various rates compared between the two. Again, this is what we have in the HEALTHeLINK records. If you want to even take that a little bit further, that will probably update in a second. So you can just play around with this however you see fit. And again, we still have some time left. Happy to take suggestions if you want to see anything.
A question says, on the comparisons link, are we able to compare to national data as well?
On this dashboard, no, the comparison is New York State only.
And then, does the website feature a repository or bibliography of published studies that have utilized Western New York HEALTHeLINK data?
It does. Steve, I know we do. Yes, we do. There are some studies published on there.
Yes, our website does have links to published studies that we have performed. We do not currently have on our website links to studies that maybe the UB researchers have done. But we have done a handful of studies over time, and those studies do have published white papers and that available. Dan just posted the studies webpage.
I just pulled up the comparison, pediatric comparison page just so folks can see what that looks like. Comorbidities is kind of fun to play with if you want to look at everyone who has tobacco use as a, as an active problem in their record. So, or you can do two at once. So everybody who uses tobacco and they are obese. So these are of the individuals living with obesity who use tobacco. The rate of diabetes is, hypertension is, asthma is. So that's kind of fun to play with. And I say play because I think I'm speaking, with like-minded folks here that we kind of like playing with this stuff. It's fun to play around. So I know I'm in good company. I do know that people use this as a teaching tool. I use this as a teaching tool. A colleague of mine who teaches at a different university created a whole assignment around this dashboard to find disparities and then design a community intervention for that. So it is being used. I use it in my own classes as well. So on that note, not anybody else want me to just scroll through anything and try to find something? I'm happy to do that. We've got 8 minutes left. Okay, so I will stop sharing so we can come on back to each other. So I really appreciate you all staying and listening to my presentation today. I hope you found it useful. If you have any questions about the dashboard itself, please feel free to reach out to me. Any questions about HEALTHeLINK? I believe Steve put his information in the chat. So we are here for you. We are here as a resource for research needs, data needs. So please use us. We're here for you, my friends. So
Great. Well, Karen, thank you. And Steve, thanks for helping answer some questions too. Everyone, have a great day.
thanks, everyone.
You too.